Peace be upon you. For some time, we have been so busy with medical education and training in many social issues that we could not discuss one of our important topics. During this period, we received many messages. So this time we decided that in our health awareness series, we would talk about a very common sign or symptom called constipation. It is a very common problem. It can be a very minor issue, and it can also be a very serious one. Therefore, ordinary people who are not doctors should know something about constipation and what it actually is. First of all, what is meant by constipation? I am a doctor, and many times patients come to me, and when I ask them what problem they have, they say, I have constipation. I ask them how many times they pass stool, and they say 6 times a day. Therefore, many people do not really know what constipation is. Some think that if they have loose stools repeatedly, that is constipation. Others think that if they have to strain, that is constipation. Some believe that hard stool is constipation. To understand constipation, let me explain that whatever food we take in through the mouth goes through the food pipe into the stomach and then into the small intestine. The small intestine has 3 parts. There, the food is broken down and digested. After that, water and essential nutrients such as carbohydrates, proteins, fats, and vitamins begin to be absorbed. Then, the food moves from the small intestine into the large intestine. The movement through the small intestine is relatively fast, but in the large intestine, it slows down. In the large intestine, salts and water are generally absorbed into the body. As the food continues moving forward, it gradually becomes drier as its water content decreases. It changes from a liquid to a semi-solid and then a solid form. When it reaches the last part of the large intestine, called the sigmoid colon, and then the rectum, there is a nervous system around it that sends a signal to the brain that stool is present and needs to be expelled. As a result, a desire to pass stool develops. A person then goes to an appropriate place, relaxes the muscles that control the rectum, and the diaphragm contracts. This increases pressure inside the abdomen, the sphincters open, and the stool is expelled. This is a normal bowel movement. Generally, people need to go to the toilet at least once a day to relieve this natural urge. Some people may need to go twice a day, and that is also normal. However, if a person goes fewer than 3 times a week, we can say that they are constipated. Similarly, if the stool is very hard, requires a lot of straining, or if a toilet visit typically takes more than 10 minutes, this also suggests constipation. In most people, constipation is not caused by a disease. Rather, it results from poor eating habits, bowel habits, and lifestyle. Therefore, let me explain what can help prevent constipation even without medication. 1. Regular meal timings. Meals should be taken on a regular schedule. People who skip meals for days and then overeat disrupt the digestive system, which is designed to function in an orderly way. 2. Adequate fiber intake. Fiber is part of our food but does not provide energy. Instead, it adds bulk. Unrefined flour, fruits, vegetables, especially raw vegetables and leafy greens are rich in fiber. If our diet lacks fiber, constipation is almost inevitable. People whose diet mainly consists of meat, junk food, and whatever is available without a balanced nutritional plan often develop constipation. 3. Drinking enough water. It is very important to drink 6 to 8 glasses of water daily. This is especially true in hot regions where more water is lost through evaporation and sweating. In winter, people often forget to drink water. Do not wait until you feel thirsty. Keep drinking water regularly. When we do not drink enough water, the stool becomes dry and hard, leading to constipation. 4. Not delaying the urge to use the toilet. Many people postpone going to the toilet because they are at work or busy. Allah has given humans voluntary control, so even if stool is present in the rectum, it can be temporarily held back by contracting certain muscles. However, if a person repeatedly delays bowel movements, more water is absorbed from the stool, making it harder and more difficult to pass. This causes pain, which leads the person to delay it even further, creating a vicious cycle. 5. Physical activity. Some studies suggest that people who do not exercise are more likely to suffer from constipation. Those who spend the entire day sitting, whether in a shop or in front of a computer, appear to experience constipation more frequently. 6. Proper posture during bowel movements. The position in which we sit during defecation also matters. I found it fascinating that there is a detailed recommended posture in the Sunnah of the Prophet Muhammad, peace be upon him. Squatting is considered beneficial. People who use a toilet seat should lean slightly forward and shift a bit more weight to the left side. This posture places pressure on part of the rectum and can make stool passage easier. Interestingly, some Western studies also mention a slight leftward lean because of the anatomy of the bowel, which may facilitate easier evacuation. So far, I have been discussing constipation caused by habits rather than disease. Let me summarize. Drink plenty of water. Eat meals at regular times. Consume a high-fiber diet rich in vegetables, salads, fruits, and whole grains. Reduce excessive red meat intake. Engage in appropriate physical activity according to your age and ability. Do not postpone the urge to pass stool. Use a proper posture when using the toilet. And now for an important point, if constipation does not improve despite following these measures, it may be a symptom of a more serious condition. I want to make it clear that this does not mean you should become anxious or fearful. However, if you have chronic constipation or if your bowel habits have recently changed, meaning you did not previously have constipation but have now started experiencing it, you should consult a doctor. Constipation can sometimes be a sign of another intestinal condition, whether serious or less serious. In particular, you should definitely see a doctor if constipation is accompanied by any of the following. 1. Alternating constipation and diarrhea. If you are constipated for a week and then develop loose stools, and this pattern repeats, you need medical evaluation. 2. Blood in the stool. Whether it is fresh blood or blood mixed with the stool, consult a doctor. 3. Feeling incomplete evacuation. If you pass stool but still feel that some remains and that you have not completely emptied your bowels, seek medical advice. 4. Mucus or pus in the stool. If mucus or pus is present, dietary changes alone are unlikely to solve the problem. 5. Pain during defecation or tissue protruding from the anus. If passing stool causes pain, or if something comes out during straining, such as a swelling, lump, or piece of tissue, this may indicate another condition that requires medical attention. 6. Unexplained weight loss. If you are losing weight and also have constipation, you should consult a doctor promptly. To summarize again, many people with constipation do not have a serious disease and can improve by changing their habits and lifestyle. However, if constipation has been present for a long time without improvement, if it alternates with diarrhea, if there is blood or pus in the stool, if you feel incomplete evacuation, if something protrudes during straining, or if you are losing weight rapidly, then do not take the problem lightly and consult your doctor.